afternoon, Ms. Rowe, fellow nursing students. We, the members of Group 1, Liliana Justilian, Davantish Arnett, Angela Humes, Rochelle Charlton, and Brittany Russell, will be presenting to you Hirschsprung disease. Our objective for this presentation is to define Hirschsprung disease, state the signs and symptoms, list the types of Hirschsprung disease, explain how to diagnose, the benefits of Hirschsprung disease, state the treatment and nursing management for Hirschsprung disease, state the surgical and medical management, and give a brief conclusion. Just a brief scenario. Patient DM, newborn male, full term, uncomplicated vaginal delivery, normal birth weight, 3.115 grams, ABGAS score, 9195. Mother was a 36-year-old, Bravo 1, Power 0, healthy woman. Started breastfeeding, first day of life. On the second and third day of feeding, it was noted that the patient had increasing abdominal distension. Within 24 hours, there were no meconium stool pass. One episode of bilious emesis. Pediatric surgical was consulted. A rectal exam was done. Empty rectal ampulla, a tight anal sphincter, large amount of stool and air upon withdrawal of finger. These were things noted. A rectal mucosal biopsy, no ganglia identified. Patient was taken to OR for an end colostomy and a Hartmann's pouch. Dilated descending and sigmoid colon, prominent colonic blood vessel, site of colostomy, frozen section of colonic musculars, prior revealed ganglion cells. Post-operative course uneventful. Stools from colostomy, post-operative day 1, tolerated breastfeeding, discharge post-operative after day 6. Second stage pull-through procedure plan in several weeks. This scenario will be explained later on through a presentation throughout the definition, signs and symptoms.
Hirschsprung disease is caused by the body's or intestines' inability to move feces out of the body. It is a rare birth defect and is a result of the absence of nerve cells called ganglions in the intestines. In an infant, Hirschsprung disease is suspected when there is no passage of meconium after birth. These ganglion cells are normally integrated all throughout the intestine and colon. However, in this disease, these nerve cells stop at a certain area of the intestine, resulting in an aganglionic area. Now, these ganglions are specifically responsible for moving fluid through the intestine, a term known as peristalsis. A lack thereof, as you may have figured, would result in some kind of blockage. There is a likely chance that this disease is also genetic. It has been found that Hirschsprung disease is most common in boys rather than girls and is seen mostly in those under the age of 10 years old. As the child eats and progresses, the parent may notice delayed growth, abdominal distension, abdominal pain, vomiting, and of course, constipation. This disease can be categorized into different groups. The most common is the ultra-short segment, and this is the absence of ganglion cells in the last 1 to 2 centimeters of the rectum. Short segment is the absence of ganglion cells in the rectum and sigmoid colon. You may know the sigmoid as the S-shaped area of the intestine. Long segment. Long segment is the absence of ganglion cells in the third portion of the intestine. And total aganglionosis. This is very rare, but it is the absence of nerve cells throughout the entire intestine. Hirschsprung disease is diagnosed by an abdominal X-ray. In this procedure, the examiner is looking for any signs of bowel obstruction, which is shown by dilation in the bowels. Contrast enema. In this procedure, a water-soluble agent is used to highlight parts of the rectum and sigmoid colon to observe bowel movement. Anal manometry. This is used to test the normal reflexes of the rectum and anus. However, to formulate a definitive diagnosis, a rectal biopsy is done. Now, in this procedure, a small tissue sample is taken from the colon and examined by a pathologist for presence of ganglion cells.
Hello everyone, I'm student nurse Charlton and I will be informing you about the complications and risk factors of Hirschsprung disease. Anastomotic leaks are defined as leaks of luminal contents from a surgical joint. They are the most important complications to recognize following pull-through procedure. Patient with Hirschsprung disease. Early diagnosis, resuscitation, and treatment of the anastomotic leak is key. Delay leads to prolonged contamination of the abdomen or chest by the luminal contents, leading to the development of severe sepsis and progression to multi-organ failure and death. It is important to remember that any patient who is not progressing as expected or who deteriorates after surgery should be considered to have anastomotic leak until proven otherwise. There are several risk factors that increase the risk of an anastomotic leak development. Patient factors. Medications such as corticosteroids and immunosuppressants, diabetes mellitus, obesity, or malnutrition. Surgical risk factors, emergency surgeries, long intraoperative time, peritoneal contamination, example from pus, feces, or GI tract contents. Strictures of colon is the narrowing of the large intestine. A stricture slows or prevent waste from passing through the large intestine. Colon strictures can be life-threatening if they are not treated. Chronic inflammation and scars from surgery, inflammatory bowel disease such as Crohn's disease can cause strictures of the colon. Your colon looping around itself can cause strictures. Strictures colon can be treated by balloon dilation may be done. A scope with the light and camera is placed into the colon. Surgery may be needed if the balloon dilation does not work. Retraction of the colon is a simple technique for performing a functional and sigmoid colostomy is reported. This procedure can help to prevent retraction of the end scoma in an obese patient or any patient with a shortened mesentery, which is an organ that attaches the intestine to posterior abdominal wall in the human and is formed by double fold of the peritoneum. Fecal incontinence is the inability to control bowel movements, causing stool to leak unexpectedly from the rectum. Fecal incontinence ranges from an occasional leakage of stool while passing gas to a complete loss of bowel control. Fecal incontinence in children after operation treatment of Hirschsprung disease may be caused not only by affected of the external sphincter muscles of the anus, the nerve plexus, and adaptation of the rectum to new conditions after pull-through operation, but also by trauma inflicted to the levator antemuscles. Persistent constipation is a condition characterized by difficult, infrequent, or perceived incomplete evacuation of bowel movement. After surgery, kids often get constipated. Constipation sometimes leads to serious colon complications like enterocolitis and toxic megacolon, which can be life-threatening. The large intestine helps absorb water from food, so dehydration can be of a concern for children who have a part of their intestine removed. Thank you.
Hello, my name is student nurse D'Angela Humes, and I was assigned benefits of Hirschsprungs disease. There are no obvious benefits to this disease. However, there are life-changing advantages after surgery. As a nurse, you should focus on providing emotional support and education. That's one of the first things you want to do to patients that may be hesitant of undergoing or hesitant for their child to undergo surgery. You also want to emphasize on maintaining a healthy diet. For anyone that is assigned to have surgery or scheduled to have surgery, you want to make sure that their bodies are in good health. So maintaining a well-balanced diet, fruits and vegetables, all of their carbs, proteins, and fats that are needed, to aid in faster wound healing and aiding the body in boosting its fight against infections. You also want to encourage patient, or you also want to educate the patient on physiological support. This is where you may have patients or family members or parents that are a little anxious about the surgery or anxious about their child going to surgery, or there may be confusions on why do we need it, is there other ways of doing it. You want to give an explanation of any medical or surgical procedure so that there wouldn't be any confusion or any fear of the procedure. You also want to encourage or educate or teach patient or a parent on how to care for a colostomy bag. Most patients are put on colostomy bags because of, we can't be able to pass normally until after surgery. And the benefit of surgery is that the child will be able to remove fecal matter normally. And this also, sheds any fears or, emotional depressions and stuff that you may be going, because it's a life-threatening thing to your child, and you want to see your child live a healthy, normal life and be able to do the things they want to do as a child and growing into adulthood. You also want to have them follow up on their appointments with their physicians. You want to make sure that they're doing well, that the child's progressing, there's no infections. You also want to teach the parent on how to care for a child or a young child, baby, neonate, that has the incision. So you want to make sure that she knows how to properly put on the diaper below the incision so that there isn't any discomfort, there isn't skin breakdown, and there isn't any infection or contamination with urine. You also want to encourage the child to aid in or participate in their self-care so that, eventually they'll be able to go back to school and be able to manage on their own without their parents being there.
Treatment and management of Hirschsprungs disease. In order to improve health of children affected by this disease, surgeries must be performed following lifestyle changes post-surgery. Hirschsprung's disease can be treated by two types of surgeries to bypass the colon when nerve cells are lacking. These procedures are known as the pull-through surgery and ostomy surgeries. The pull-through surgery is performed using laparoscopic methods through the anus. This allows for the lining of the diseased part of the colon to be removed. After its removal, the normal section is then pulled through the colon from the inside and then attached to the anus. Ostomy surgeries causes a change in the way urine and fecal matter exits the body as a result of the surgical procedure. Bodily waste is rerouted from the usual path due to malfunctioning parts of the urinary or digestive systems. Ostomy surgeries allows the body to get rid of waste, and the waste then passes through a surgically created stoma on the abdomen into a prosthetic known as the pouch or ostomy bag located on the outside of the body. There are several types of ostomies. They include colostomy, urostomy, ileostomy, J-pouch, and the continent urostomies. For the colostomy, the surgically created opening
For a child suffering from Hirschsprung disease, the following medical and surgical managements are done. Firstly, the doctor would have the child on an initial therapy. This includes the administration of intravenous fluids, and the doctor would restrict any further enteral feedings. The child would have an NG tube placed to remove stomach contents, which is called decompression. There's no specific diet pre-operatively, but post-operatively, if the child would be placed on a non-constipated regime to decrease any likelihood of constipation. The child will be placed on broad-spectrum antibiotics, which include your Augmentin and ciprofloxacin, to decrease any chance of the child developing an infection. Surgical management. The child would have had either a single stage pull through surgery, which involves a part of the large intestine that is missing the nerve cells is removed and is connected to the healthy part of the colon. Or the child could have an ostomy surgery, which include the doctor creating a stoma in the abdominal wall to facilitate the movement of waste products. For the nursing management, there are a lot of things that we as nurses could do to make sure the overall well-being of our patient. So therefore, we have to promote comfort. We have to look out for signs that the child is in pain, for example, agitation and crying. So therefore, we have to stroke the child, we have to cuddle with the child, and we have to also maintain position changes. We have to maintain skin integrity, which means that we will be checking the site for consistency. We will be checking the site for any increase in body temperature, for any redness or swelling, which all could indicate infections. We have to make sure that we maintain oral hygiene for our patient to prevent NG irritation. We also have to keep the mucous membrane moist to also decrease irritation. We have to do our family teaching. Therefore, you would teach the family, you teach the parents that, okay, this child would have just had a surgery, so therefore they need to be on a non-constipated regime. So there should be a lot of fruits and vegetables in their diet. There should be a lot of fibrous foods in their diet, and this child should be on a lot of fluids as well. The child could do physical activity, which include just a stroll to help the body to release to help the body with constipation and to help blood flow throughout the body. You would have to teach the parent that they should monitor the incision site for any signs of infection, such as redness, swollen, being painful, or any discharge coming off the area. And if they see those signs, that they should contact the child's healthcare provider right away. You have to also teach the parent that they should follow up with with any doctor's appointment. You would also teach the parent, educate the parent how to clean and care for the ostomy site.